Hi everyone, welcome back to my YouTube channel. Today's talk is about CMS Final Rule for Fiscal Year 2024 Skilled Nursing Facility Prospective Payment System. Let's dive right in. Fiscal Year 2024 updates to the SNF payment rates. CMS estimates that the aggregate impact of the payment policies in this rule would result in a net increase of 4% or approximately $1.4 billion in Medicare Part A payments to SNFs in fiscal year 2024. This estimate reflects a $2.2 billion increase resulting from the 6.4% net market basket update to the payment rates, which is based on a 3% SNF market basket increase plus a 3.6% market basket forecast error adjustment and less a 0.2% productivity adjustment as well as a negative 2.3% or approximately $789 million decrease in the fiscal year 2024 SNF PPS rates as a result of the second phase of the patient-driven payment model or PDPM parity adjustment recalibration. Changes in PDPM ICD-10 code mappings. The PDPM utilizes the International Classification of Diseases 10th revision clinical modification or ICD-10 codes in several ways, including using the person's primary diagnosis to assign patients to clinical categories. In response to stakeholder feedback and to improve consistency between the ICD-10 code mappings and current ICD-10 coding guidelines, CMS is finalizing several changes to the PDPM ICD-10 code mappings. The ICD-10 code mappings and lists used under PDPM are available on the PDPM website at the link that you can see on this slide. I have also pasted this link in the description box down below for your convenience. Exclusion of marriage and family therapists and mental health counselor services from SNF consolidated billing. Section 4121A4 of the Consolidated Appropriations Act of 2023 requires Medicare to exclude marriage and family therapist services and mental health counselor services from SNF consolidated billing. Exclusion from consolidated billing allows these services to be billed separately by the performing clinician rather than being included in the Medicare Part A SNF payment. CMS is finalizing regulatory text changes required to codify this new legislative requirement to exclude marriage and family therapists and mental health counselor services from SNF consolidated billing for services furnished on or after January 1st, 2024. Changes to the Skilled Nursing Facility Quality Reporting Program. The SNF Quality Reporting Program is a pay-for-reporting program. SNFs that do not meet reporting requirements are subject to a 2% percentage point reduction in their annual payment update. In the fiscal year 2024 SNF PPS Final Rule, CMS is adopting two measures in the SNF Quality Reporting Program, removing three measures from the SNF Quality Reporting Program, and modifying one measure in the SNF Quality Reporting Program. In addition, this rule makes policy changes to the SNF Quality Reporting Program and begins public reporting of four measures. CMS is adopting the Discharge Function Score or DC function measure beginning with the fiscal year 2025 SNF Quality Reporting Program. This measure assesses functional status by assessing the percentage of SNF residents who meet or exceed an expected discharge function score and uses mobility and self-care items already collected on the minimum data set or MDS. CMS is adopting the COVID-19 vaccine percent of patients/residents who are up to date measure beginning with the fiscal year 2026 SNF Quality Reporting Program. This measure reports the percentage of stays in which residents in a SNF are up to date with recommended COVID-19 vaccinations in accordance with the Centers for Disease Control and Prevention's or CDC's most recent guidance. Data will be collected using a new standardized item on the MDS. CMS is modifying the COVID-19 vaccination coverage among healthcare personnel measure beginning with the fiscal year 2025 SNF Quality Reporting Program. This measure tracks the percentage of healthcare personnel or HCP working in SNFs who are considered up to date with recommended COVID-19 vaccination in accordance with the CDC's most recent guidance. The prior version of this measure reported only on whether healthcare personnel had received the primary vaccination series for COVID-19, while the modified measure requires SNFs to report the cumulative number of healthcare personnel who are up to date with recommended COVID-19 vaccinations in accordance with the CDC's most recent guidance. CMS is removing the application of percent of long-term care hospital patients with an admission and discharge, functional assessment, and a care plan that addresses function measure beginning with the fiscal year 2025 SNF Quality Reporting Program. CMS is removing this measure for two reasons. First, the application of functional assessment / care plan measure meets the conditions for measure removal factor 1. Measure performance among SNFs is so high and unvarying that meaningful distinctions in performance improvements can no longer be made. Second, this measure meets the conditions for measure removal factor 6. There is an available measure, the DC function measure discussed above, that is more strongly associated with desired resident functional outcomes. CMS is removing the application of the IRF functional outcome measures change in self-care score for medical rehabilitation patients or change in self-care score measure and the application of the IRF functional outcome measures change in mobility score for medical rehabilitation patients or change in mobility score measure beginning with the fiscal year 2025 SNF Quality Reporting Program. CMS is removing these two measures because they meet the condition for measure removal factor 8. The costs associated with the measure outweigh the benefits of its use in the program. Additionally, these measures are similar to or duplicative of other measures within the SNF Quality Reporting Program. CMS is increasing the SNF Quality Reporting Program data completion thresholds for the minimum data set or MDS data items beginning with the fiscal year 2026 SNF Quality Reporting Program. SNFs must report 100% of the required quality measure data and standardized resident assessment data collected using the MDS on at least 90% of the assessments they submit to CMS. Any SNF that does not meet the requirement will be subject to a reduction of 2 percentage points to the applicable fiscal year annual payment update beginning with the fiscal year 2026. CMS is beginning the public reporting of the transfer of health information to the provider PAC measure and the transfer of health information to the patient PAC measure with the October 2025 Care Compare refresh or as soon as technically feasible. These measures report the percentage of patient stays with a discharge assessment indicating that a current reconciled medication list was provided to the subsequent provider or the patient/family/caregiver at discharge or transfer. After consideration of the public comments received, CMS is not adopting the Core Q short stay discharge measure for inclusion in the SNF Quality Reporting Program. Changes to the Skilled Nursing Facility Value-Based Purchasing Program. The Skilled Nursing Facility Value-Based Purchasing or SNF VBP program rewards SNFs with incentive payments based on the quality of care they provide. All SNFs paid under Medicare's SNF Prospective Payment System are included in the SNF Value-Based Purchasing Program. In this final rule, CMS is adopting 4 new quality measures, replacing one quality measure and finalizing several policy changes in the SNF Value-Based Purchasing Program. The new quality measures are as follows. CMS is adopting the nursing staff turnover measure for the SNF Value-Based Purchasing Program beginning with the fiscal year 2026 program year. CMS is adopting the discharge function score measure beginning with the fiscal year 2027 program year. CMS is adopting the long stay hospitalization measure per 1,000 resident days beginning with the fiscal year 2027 program year. This measure assesses the hospitalization rate of long stay residents. CMS is also adopting the percent of residents experiencing one or more falls with major injury for long stay residents beginning with the fiscal year 2027 program year. This measure assesses the falls with major injury rates of long stay residents. CMS is replacing the skilled nursing facility 30-day all-cause readmission measure with the skilled nursing facility within stay potentially preventable readmissions measure beginning with the fiscal year 2028 program year. To prioritize the achievement of health equity, improve care that all beneficiaries receive, and reduce disparities in health outcomes in SNFs, CMS is adopting a health equity adjustment in the SNF value-based purchasing program. This adjustment rewards SNFs that perform well and whose resident population during the applicable performance period include at least 20% of residents with dual eligibility status. This adjustment will begin with the fiscal year 2027 program year. CMS is adjusting the scoring methodology to provide bonus points to high-performing facilities that provide care to a higher proportion of duals. This approach of rewarding excellent care for underserved populations is consistent with other approaches in other quality and value-based programs, including the Medicare Shared Savings Program, Medicare Advantage, and Part D star ratings and the policy changes in the hospital value-based purchasing program. In addition, CMS is increasing the payback percentage policy under the SNF value-based purchasing program from the current 60% to a level such that the bonuses provided to the high-performing, high-dual SNFs do not come at the expense of the other SNFs. The estimated payback percentage for the fiscal year 2027 program year is 66%. CMS is adopting the audit portion of the validation process for MDS-based measures beginning with the fiscal year 2027 program year. Changes to civil money penalties or CMP, waiver of hearing, reduction of penalty amount. In this rule, CMS is streamlining an administrative procedure for CMS by adopting a constructive waiver process that will consider a facility to have waived its hearing when CMS does not receive a request for a hearing within the requisite time frame. The accompanying 35% penalty reduction would remain unchanged, though CMS is committing to review the appropriateness of this policy and the reduction amount in the future. This revision will reduce the administrative burden for CMS and allow the agency to shift resources toward bolstering other oversight and enforcement activities, including providing additional focus on nursing home compliance. Thank you for joining me today. I appreciate your time and attention. If you enjoyed this video, please consider subscribing to my channel. Hope to see you next time. Bye now.